She got it wet. Hey, girl, how you doing? Look, I'm double up. Girl, I'm a star.
Hello everyone, I welcome you all in my channel Just Breathe. Today we're gonna talk about antisocial personality disorder. These disorders are related to mental health conditions that affect how someone thinks, perceives, feels, or relate to others. So let's start our video. Antisocial personality disorder is a particularly challenging type of personality disorder that is characterized by impulsive, irresponsible, and other often criminal behavior. Someone with antisocial personality disorder will typically be manipulative and reckless and won't care for the other people's feelings. Like other type of personality disorder, antisocial personality disorder is on a spectrum, which means it can range in severity from occasional bad behavior to repeatedly breaking the law or committing serious crimes. A person with antisocial personality disorder may have these problems: exploit, manipulate, or violate the right of others, lack concern, regret, or remorse about others people's distress, behave irresponsibly, and show disregard for normal social behavior, have difficulty in sustaining long-term relationships, be unable to control their anger, lack guilt, and not learn from their mistakes, blame others for the problems in their lives, repeatedly breaking the law. A person with antisocial personality disorder will have a history of conduct disorder during childhood, such as truancy, not going to school, delinquency, for example, committing crimes or substance misuse, and other destructive and aggressive behaviors. Antisocial personality disorder affect more men than women. It is not known why some people develop antisocial personality disorder, but both genetics and traumatic childhood experiences, such as child abuse or neglect, are thought to play a major role. A person with antisocial personality disorder will have often grown up in difficult family circumstances. One or both parents may misuse alcohol, or parental conflict and harsh, inconsistent parenting are common. As a result of these problems, social services may become involved with the child's care. These type of difficulties in childhood will often lead to behavior problems during adulthood and adolescence. Criminal behavior is a key feature of antisocial personality disorder, and there is a high risk that someone with disorder will commit crimes and to be imprisoned at some point of in their life. Men with antisocial personality disorder have been found to be 3 to 5 times more likely to misuse alcohol and drugs than those without the disorder, and have an increased risk of dying permanently as a result of reckless behavior or attempting suicide. To be diagnosed with antisocial personality disorder, a person will usually have a history of conduct disorder before the age of 15. Antisocial personality disorder is diagnosed after rigorous physiological assessment. A diagnosis can be made if the person is aged 18 years or older than that, and at least three of the following criteria apply: repeatedly breaking the law, repeatedly being deceitful, being impulsive or incapable of planning ahead, being irritable or aggressive, having a reckless disagreed for their safety or the safety of others. In the past, antisocial personality disorder was thought to be a lifelong disorder, but that's not always the same case, and it can sometimes be managed and treated. But antisocial personality disorder is one of the most typical types of personality disorders to treat. A person with antisocial personality disorder may have a reluctant to seek treatment and may only start therapy when ordered to do so by a court. The recommended treatment for someone with antisocial personality disorder will depend on their circumstances, taking to account into factors such as age, offending history, and whether there are any associated problems such as alcohol or drug abuse. The person, families, friends, and often play a effective role in making decision about their treatment and care. In this, only talk therapies, democratic therapy communities, meditation, and meditation is the only suggestion which is given to these disorders.